Hi there, everyone. Hi, good afternoon. This is Camellia. I am now live, and I think you guys can probably hear me okay. I see a couple of you here already. But I just wanted to briefly check in today. I know it's Labor Day. Hopefully, I'm catching more of you now since most don't work on Labor Day. But if you're in nursing, you probably are working. But I did want to just briefly check in. I know it's been a while since I checked in with you guys. And I mentioned in the previous live that I am aiming to try to do a live at least once a month so that we can talk through any questions you guys have, anything that's come up that maybe I can answer that I've experienced. Of course, I don't know everything, but I do want to spend this time to answer any questions that you guys do have. And that's specifically about the PMHNP role. Let me back up. My name's Camellia. I'm a psychiatric mental health nurse practitioner. Most of you have followed me for quite some time. You're nursing students, you're PMHNP students. So thank you for joining. Patricia, I see that you're here. I'm doing well. I hope you are today. Um, this is a holiday for most, and so hopefully I'm catching more of you today, as I mentioned. But really, this is designed to be very informal. Any questions that you guys have for me about the PMHNP role, maybe where you are in your career, maybe if you're considering the role in itself, or anything that you've come across if you're also a practicing PMHNP, or I know I also have a few FNPs on here as well. So I'll just let you guys ask me any questions that have come up that you have. Hopefully, you guys are, as I see you joining, you have some questions maybe that I can answer for you. But I really am here to answer any questions, maybe just to interact with you guys a little better about the PMHNP role. And so most of you, if you followed my channel, you know that I've been practicing for quite some time, and have come across quite a few things. But I don't, like I said, don't know everything. But most of these questions, what I've found, and my reason for also doing these regular lives, is that most of you have the same questions. So I figured it would be good to really just have you all ask those questions live so that I can answer them live, and then people that have the same questions can come back for the answers. Thank you for your question, Patricia. I see you mentioned, do I think mental health tech can be a great way to get a taste of psych nursing? Absolutely. Absolutely. And actually compare this to if you're a nurse and you've been a nurse. Most of you know, like, the old school way of nursing, and some programs still have this in place, that you had to actually have some form of nursing or nurse aid experience prior to becoming a nurse. And so I see that the same as if you're a mental health tech. You are actually engaging with patients, you're getting lots of experience with patients. And so I think it is a great segue to one, nursing, but secondly, particularly psychiatric nursing, or even going further to be a PMHNP. So it definitely gives you the experience. It also helps you to be able to interact with patients, um, knowing how to do that, knowing how to handle, situations that are high acuity, also situations that may escalate. Most people who work on psych units know you have to have certain training for escalation and other behavioral health things that may come up. And so I think if you are a tech on the unit, if you're working bedside psych, that's probably the best experience you can have if you're considering being a psych nurse. And even as you go, maybe a Psych NP if that's what you're considering. Okay. I hope that answers your question. Let me know. Do you have any other questions for me? Does that answer it? You can just put that in the chat there. And hopefully that answers. And you guys, I'll just be honest, my computer's doing something funky here. So hopefully I don't lose you guys. If so, I will pop back on. But tell me, Patricia, just let me know if that answered your question. And hopefully you guys don't have any trouble hearing me. But yes, to answer your question, Yeah, I think mental health tech, or it's called different things in different places. Where I worked on the bedside, they were called behavioral health techs. Same thing, but you're still working with that population, so it gets you a lot of good experience. Yep, very good experience. Great question. I see a couple more of you have joined. So again, this is just a way to ask me any questions. While I have you guys, most of you have the same question. So I do see another one here. You're looking for a PMHNP preceptor. You signed up with multiple sites, but it's going slow. Do I do telepsych precepting? Great question. I will say that currently I am not doing any precepting by telepsych, and that is specific to the organization that I'm working with. So I won't say that I don't have a desire to do that, and I won't say that I'll never do that, but I do have some limitations with currently where I'm working. And so I have asked specific questions about the preceptorship program, and so they're revamping that at this point. And so that is on hold for me to be a preceptor. I have a long list of people who have requested that, and as you guys know, I did a video about this, a couple videos actually, that it's so hard to find preceptors these days for a lot of reasons. Most organizations are allowing you, or programs are allowing you to do telepsych with a few hours. So if you can do that, great. But currently, myself individually, I'm not offering any preceptorships right now. But definitely feel free to ping me. I'm in North Carolina as well, and so some of the programs, at least from the different students that I've talked to, they actually require you to be at least in the same state as the preceptor. So I don't know if that would make a difference for you, but definitely you can ping me on any of the avenues of communication on the about section of this channel, and I'm happy to maybe add you to the list if something does come up for me in the future. Okay, but just remember that I am in North Carolina if that makes a difference. Okay, great question. And I know this has been an ongoing thing. This is really tough for you guys. I know it sounds like you've signed up for a few of the sites where they try to find you preceptors as well. But stay tuned on that. Of course, these things do change as we go. And, I think this is tough. It's tough to, be in this space, but I do think that you will find someone eventually. I would just say being patient is important, but just continuing to do your due diligence, as I know you're probably doing right now. Um, I actually graduated in 2017, and this was just as much of an issue then. Maybe not quite as much because the demand was not as high, but it was an issue because we did not have as many practicing PMHNPs in 2017, which most programs require that. So I know that this is pretty limiting, but hopefully you'll be able to find someone quickly. Okay. And Patricia, you said, I forgot to add that you're doing a great job. Thanks for answering your question. Absolutely. And thanks for the feedback. As I said, I don't know everything, but I'm hopeful that this is just a good way, a platform to support you guys in any way. And if you're on this journey, of course, we all kind of hit the same roadblocks, is what I've found. And so if I can, make that easier for someone, whether it reduces your time, your efforts, then that's the whole goal of this channel. So thank you for that feedback. Um, I also see, Patricia, that you had a question about what qualifies someone to be a preceptor. So another great question. And you're welcome, the D squad. You're the one that asked the question about the precepting. You're absolutely welcome. So what qualifies someone to be a preceptor? First, if you are in a PMHNP program, most of the programs require that you follow either a psychiatrist or a psychiatric mental health nurse practitioner. And as I said, that's one of the things that was a little more challenging for me as I came up, because there were not a lot of PMHNPs in my area, but that was a specific requirement for the organ or the program. So that's the first step, is to be sure that they have the qualified experience, um, being in they're working in mental health, and they are either a psychiatrist or a PMHNP. The other thing that is important is some of the programs do require the practicing preceptor to actually have been in practice and actually operating as a clinician I've seen a little bit of variation there, but a lot of them do require at least 2 years. So that goes without saying, just because, jumping into something, one, you're learning yourself, and then want to have some level of experience before you're starting to help support others in that way. Um, so hopefully that answers your question, but there are specifics with each program that I've found. And so you do want to specify before you start going on the search for preceptors. Most preceptors do not allow you to do primary care physicians. And most preceptors, they actually do allow you to do some of your preceptorship with like a social worker or someone who's doing counseling. Um, in a PMHNP program, you have to have allotted hours for therapy. And so that's the only time where there is a variation between following a preceptor or a Psych NP. You can actually follow usually a counselor or a licensed social worker who would be practicing therapy. Okay. So that's pretty much the general idea of it. But like I said, most programs have very specific things that they're requiring when you are looking for a preceptor that they'll actually accept. Okay. Very good question. You guys have really hit it off pretty quickly here, which is great. This is going to be recorded as well, so it will be available to replay later. But any other questions that you guys have, I do want to spend a little time talking about clinicals, which is very funny that you guys are asking about preceptorship. But I do have a little snippet from one of the other my subscribers who asked about how to prepare for clinical. So I do want to spend a little time talking about that. But what questions do you guys have for me? What other questions do you have? I see that a couple more of you have joined. How do you navigate paying for your program? When did I start studying for boards, and what resources do you recommend? Okay, very good question. Maureen, thank you for your question. I have a couple of videos about these things as well that will go into this in more detail. But in terms of paying for the program, so there's different variations of how to do that. I worked full time for some of my program, and then I actually ended up doing PRN for a lot of the rest of the time that I was in school. So what did that allow me? It allowed me some flexibility with my hours, because once I got to a full clinical practicum, it was like working another job. So it gave me the flexibility. The other side of it was the PRN pay rate is higher. So that allowed me a little bit of a buffer with being able to pay for my program, but also working more hours when I could and when I wanted to. It just gave me that type of flexibility. Um, so I will say that, you want to really think about that as you go. Of course, this is another cost and another thing with, advancing your degree. And so it's not free for most. The other thing you may want to think about is if you are working for a federally qualified program or a facility for behavioral health, which we have a couple here in North Carolina, you can actually qualify for reimbursement of your program. So that depends on if you want to commit to, I think it's a 2-year commitment. And of course, you have to find which programs actually qualify for that. But I actually have seen a couple of job postings recently that are looking for clinicians for those federally funded programs. And once you commit, you are able to get reimbursement for your tuition. So that's another thing to think about. I can't think of the website off the top of my head right now, but I will drop that later, just so you can kind of get an idea of what that looks like. Okay. When did I start studying for boards? And what resources do I recommend? I actually started studying probably about 6 months prior to graduation. And that was because for my particular program, the last few months was focused on the clinical practicum. So I didn't have a lot of didactic work to commit to. And so what I did with my time was use that to go through questions, answer questions about, what test review questions basically. There's a few different sites for that. The ANCC, actually, which is the accrediting body for Psych NPs, they actually do have a pretty good test bank as well. And I'm trying to get this resource here for you guys, which I have shared with you all before. but I do want to this is also something that I used. I think it's now recommended in a lot of the programs, but it's called Psychiatric Mental Health Nurse Practitioner. This is the fourth edition. Um, but it actually has like lots of questions, the rationale for questions. It's a pretty easy read in terms of like not looking like information overload, but it's bulleted basically for a lot of the information and the content, and it allows you to kind of quickly review and then answer questions. Um, yeah, so this was helpful for me. This was actually my main study resource when I was doing independent study, but I actually did do the review course as well, which was, I think, about 2 months prior to taking my boards. So the one that I actually completed was the Barkley and Associates. There's a Fitzgerald one and there's a Barkley. I've done reviews for Fitzgerald, but Barkley is the one that I did prior to taking the exam. And the benefit of that was that it came with lots of questions as well. And so basically, my method was kind of going back to the information that didn't stick as well for me or that I still didn't feel like I had a good grasp on. And so I started there and then I was able to kind of trail back to study those specific areas. So hopefully this helps you. Everybody's way of studying is a little different, but you do want to get into the habit of lots of practice questions and understanding the rationale for those questions. Okay. The other important part about this is that you are not operating in any capacity on this exam as a nurse. And so the reason I say practicing questions is going to be helpful because you want to start getting in the mindset of a clinician and as a Psych NP, which is a huge gap. And there's a transition that you have to think about mentally here. You are just, if you've been a nurse and you've worked at the bedside, you automatically kind of want to do the things that you would do as a nurse, but you have to put on your provider hat with this exam and really be able to think about it from that perspective. Okay, so answering those questions is definitely where I found the most benefit in understanding the rationale for those questions. Okay. So hopefully that answered. I know that was kind of long-winded, but hopefully that answered something for you. I'm happy to share anything else if you'd like offline. You can always ping me. And as I said, the about section of my channel has all of my contact information, which I get lots of questions all the time about these types of things. Okay. So okay, you're welcome, Maureen. I do see that here. And the D Squad, you mentioned that the purple book is like your study Bible. This is probably what you're talking about. This is the DSM-5, and this is one thing you want to actually have pretty handy um, as you go. You guys see, I'm operating here in my office, and this is what I have right beside me. It's a very good resource, but you're exactly right. This is how you're going to become a good diagnostician. Um, and you're talking about the purple PMHNP cert book. I see. Okay. I thought you were talking about the DSM-5, which is referred to as the Bible as well. So I misunderstood that. But the purple one is I'm assuming it's different than the one I just showed. If you want to drop the name of that so other people have it, that would be great. But I'm not aware of that one in particular if it is different from this one. But feel free to share that here if you'd like. It's the first one that I showed. Okay. Yeah. So that's the most common one. And like I said, I've worked with a lot of students, and most of them, their programs are recommending that one as well. Okay, very good. Well, I'll wait for you guys. I was planning to be on here for about 30 minutes. So if you have other questions, let me know. But I did want to spend a little time talking briefly about how to prepare for clinicals. I do also have another video about this that kind of goes into more detail about other things that I won't get into today. But it's interesting that we've already talked a little bit about preceptorship, which kind of is a good segue to talk about how to prepare for clinicals. So, as most of you know, if you're not in that part of your program now, first of all, finding a preceptor is the first thing, right? But you also want, in most programs, you're going to be doing either a shadowing experience to start, or you're going to be actually engaged into patient care. So I say that the difference there, when for my program, we started out as more of a shadowing experience. And then as the semesters went on, then I was more focused on actually working with patients. And so most programs are set up that way. But I say that because as you're setting goals for your clinical practicums as well as your preceptorships, you do want to think about what your role is as a student in that particular setting. Okay. So the first thing I would say is to set goals ahead of time. You want to set your own goals, and then you want to set goals with your preceptor. And you may even want to share your goals, your individual goals, with your preceptor. I always say that because you may get with a preceptor who hasn't worked with students, or you may get a preceptor who doesn't want to precept. That's a reality. You may get a preceptor who is just not really focused on the teaching aspect of things. And so I think the best way for you to go into any type of preceptorship is to basically have your foundation set where your preceptor understands what you're looking for. Even what your program is expecting for the preceptorship is also important. Okay, so you do want to be able to share that information with your preceptor. And then being prepared is important. So whatever the guidelines look like for your program, you want to have templates available. I have one here on this channel that is more conversational in terms of what you when you're doing a psychiatric interview. You want to have your DSM, which I just showed, which I thought you were referring to the purple book. And then you want to have a good source of a medication guide, whatever that looks like for you. Some people like Stalls. Stalls has a pocket guide. For some people, that's a little bit more information overload. And so there are other resources out there. What I use in my daily practice, there's a Medscape and there's Epocrates. Epocrates I use pretty often here on my phone. It is an app that you can download that will allow you to kind of do more of the medication focused part of your treatment. So you do want to have those things available. And I'm sort of looking around because I did jot some of this down. And then you want to actually be in a space where you set goal or you take notes. Taking notes is going to be very important. It was very helpful for me to take notes because if there was something that I rarely saw or that I didn't learn a lot about in the didactic side of things, then I was able to go back and research that information. Okay. You want to just get in the practice of, and I still do this in my daily practice. If there is something that I have not seen in a while or that I've not seen a lot of in terms of diagnosis, treatment, then I do go back and kind of review my information. Whatever that study guide looks like or that resource looks like for you, it is very important to go back and review that information. Okay. There are some of these things that will be on your exam as well. And so I always say that, the rare thing that you may not see ever again is probably going to be the thing that you get stumped on with your exam. So you do want to just be sure that if there's something that you really don't have a good grasp on, or that, hey, I've never seen this before, or they didn't really explain this way in my program, go back and research that and get in the habit of doing that, so that the things that you don't see as often will become more at the forefront, and you'll be able to, once you see it again, you'll be able to really know how to handle it and what to do. Okay. Um, Jot down the things that you don't know, you want to explore further, you're unsure about. Those are all the things I would say take notes about. And that's pretty much the gist of it. Preparation with the tools that you have available when you're going to clinicals, setting goals with your preceptor, and maybe even having a point where you check back in with your preceptor to say, this is what I would like more of, or is there a way that I can engage with patients more? Is there anything I can do? What would you recommend? Always kind of have that open rapport with your preceptor so that you get the most out of your learning experience. Okay. So just keep those things in mind as you guys are navigating this. And I always say that your preceptorships are the most important part of your program. And yes, we're going to get the didactic knowledge. However, when you are going to work with patients, that is the closest that you're going to get to your actual job and role as a psych NP. Okay. So you want to be very engaged with this process. You don't want this to be like a checking a box where you just get it done or you just get the hours completed. You really want to be engaged as you're going through this process, because it's the most important part of it. Okay. So hopefully that helped you guys a little bit. You also asked a question, Maureen. Can you please share the helpful apps? So they're the ones I think you're probably mentioning that I just said. It's called Hippocrates, and I can actually type that in the chat here. And the other one is called Medscape. Okay. So those are two that you can use, more specifically for medication questions or things that come up around medications. The one that I use every single day is Hippocrates. So hopefully that'll help you guys as you're also navigating. Stalls is another one. I'm gonna type that one here as well. Most of the programs require the actual textbook for stalls, but there is a pocket guide for stalls as well. So that one is psychopharmacology. So that's another good resource. Okay. Other questions you guys have, I'm going to actually end this here in just a minute or so, but any other questions you guys have for me? I see a couple more of you have popped on. And I've just been answering just informally some questions that people have had about the role. So if you just joined, feel free to ask me any questions. I am going to stay on for another couple of minutes. Anything else that you guys have? And I just also reviewed for those of you that joined, just some tidbits to kind of keep in mind as you are navigating the preceptorship as in your clinicals. Okay, so this will be recorded, so you can always go back and look at the video. I have another question from the D squad. Looking back, what goals do you wish you had, or what do you wish you did more of during clinical rotations? I wished I asked more questions. Looking back, it's almost as if like you don't know what you don't know, right? And so as a student, as you're navigating these things, um, just asking questions, I think will just help to be a good avenue for you generally. But as you continue, as you're working with supervising physicians, just being able to ask those questions and feeling comfortable doing that. I wish I had asked more questions. It didn't, I mean, it affected me from a perspective of, uh, just as I was taking the exam and preparing for that. But just as I'm working and just starting out in practice, these things do show up again. And so the things that I was wondering about before that I should have asked a question about, I did actually see it as I was practicing. And so it's important that you just ask the question. If you're thinking about it, if it comes up to you, a question for you, go ahead and ask the question. And hopefully you feel comfortable doing that with your preceptor. Yeah. Um, Other goals, there aren't any other goals that I wish I had. I can't think of anything else specifically regarding clinical rotations, but asking questions is basically, and that's going to continue as you go as well. Like I said, as you're working with supervising physicians, you want to be in a space, and I talked about this on another video as well, that you feel comfortable asking questions because you are going to be functioning independently, right? So I say that because I don't think we grasp that as good as we probably should, in understanding that there is no like trial for this. Like once you graduate, you take your boards, you start a job, of course you're going to have support, but in most cases it's going to be you and the patient. And so there are usually places where you can ask questions or you may be able to ping your supervising physician, but some of this is about asking the questions that don't really make a lot of sense, or the things that you found that really you weren't really sure about, because I assure you that these things will come up again in practice. Okay, so hopefully that helps you a little bit. And I do have another question here before we end. What are your tips for calming the patient when they want to get physical? Okay. So good question. You're welcome. Um, so I will say that this doesn't happen often. That's also another thing that I don't see as much because I'm in telepsych right now. But I have worked the bedside and I have worked in the emergency department in behavioral health. I've worked as a psych NP there in the ED. What I will say is, so most of the places, if you are required to work in settings where that potential is there, you do have to have crisis prevention uh, counseling or some type of training for de-escalation. So a lot of those, it's called CPI. Here it's called CPI. There's other names for it in different areas, but it's basically a training course to help you to de-escalate situations. The one thing I will say that's important when you have a patient that you think is escalating. So usually there's body language that changes, there's tone that changes, there are verbal things that are said before a patient becomes physical. So I will say that the first thing for you is just assessing what's going on, what's the situation, what does the patient look like in terms of their body language, what are they telling you without saying. I think it's very important to understand. And then having means where you're able to back off on whatever's triggering the patient, or if sometimes it may require that you get additional staff involved or you give staff a heads up about what's happening with the patient. I know basically for this on the bedside, at the bedside, we would basically call our security team ahead of time if we thought that something was going to get to that point. Okay. So in most places, unless you're working private practice, you are going to have security there. There's been situations where security may have to escort you if you're working with a patient that tries to get physical. I will say, in the grand scheme of things, although it seems that this is a pretty common thing, I have had this question a lot. It's not as common as we think with patients. It's not as common, and so, but you do want to be prepared for if it does happen. And I will say, first, preparation is important for you. So understanding what is happening with the patient, what do they look like, and then them showing you that body language so that you can be prepared to get additional staff, whether that includes your security or whatever that looks like involved. Okay. You don't want to continue probing the patient when they're escalated as well. So if you have someone who's already escalated, it's very important that you just actively listen and do less talking. I found that the more talking that happens, the more patients get escalated. Okay. So you do want to just pay attention to what's happening. Every situation is going to be different here. But understanding what the source of the escalation is, removing it if you can. And sometimes it's just not a rational thing to do. You're not able to remove it. Sometimes you may not know why the patient's escalating. But in those cases, you want to just be prepared about what does your emergency response look like. Um, of course, in behavioral health, your emergency response is going to be including those additional staff to help support you. Okay. One other thing that I learned, and this is something that we learn in CPI, which is that training I was talking about, is never be in a position where you're pinned into a room. If you're going to be speaking with a patient directly, it sounds like you may be a behavioral health tech as well. You always want to have, it should be the bed and the patient, then you, and then the door. Okay. So you do want to be prepared in that way as far as physical environment. Of course, you're probably not going to approach a patient who gets more physical or that you know is escalating. But in cases where this happens pretty quickly, that's another way for you to prepare. Okay. Look up the CPI training as well. It's crisis prevention. I think it's Institute, and it's a de escalation, it's a behavioral health specific training for situations like you just mentioned. Okay. Hopefully that helps you some. I know every situation, like I said, it's a little different. Yeah, you're welcome. You're welcome. I did have a couple more joins. I'll just hang around for another minute. We're 34 minutes into this live, and so I don't want it to be too long. But any last minute questions that you guys have for me about the PMHNP role, if you're thinking about it, you are actually in it, you're a student maybe now. What other questions do you guys have for me? Anything else? Any other questions? Insurance or private pay? Are you asking about my current position, or are you asking which is better? Give me a little more information there. The D squad. Tell me what you mean. Give me a specific. Clarify that a little bit for me about insurance or private pay. Your question. Um, and I'll try to answer it as best I can. Insurance or private pay. So you may be asking me about. Oh, that's okay. So you're doing a lot at once. It's perfectly fine. That's the story of my life these days as well. In practice, do I feel that insurance or private pay is the best way to go? Um, I think that depends. If you're considering private practice, this is a question that you are going to have to definitely consider, um, and you're going to have to think about what your end goal is, and some of the ins and outs of this. The only time this comes up for most is if you are in private practice or you're working for a telehealth company as a 1099 contractor. Sometimes those are more private pay positions. But in terms of working for big organizations, most of them only accept insurance, and there are private pay options for patients that don't have insurance. But if you're working specifically for private practice and you're maybe considering your own practice, um, there are some drawbacks, and this is why you see that a lot of private practices do not take insurance. It's because one, the rates are they can be pretty low in terms of what you would typically get from like an initial visit based on the coding or follow-up visit. And the other thing is the reimbursement time that you have to really have a buffer because the reimbursement does take quite some time. For most of these insurance carriers, you have to have someone for billing. And so that's the other thing about having insurance. For patients, what I found is that it usually works better because usually when it's private pay, you're only going to be catering to a certain population of patients. So if your overall goal is to be able to serve as many patients as you can from different walks of life and um, different diagnoses and different treatment methods, then insurance is usually the way that you're going to get a more versed patient population. Okay, that goes without saying, but a lot of private practices do not offer insurance or take insurance because of one, the rates are lower, and then secondly, the reimbursement time frame can be extensive. And so in those cases, if you're thinking about it from a financial perspective, you kind of do have to prepare for the wait time for the reimbursement. And currently, I am working at a practice where we accept insurance. So, but I did work at a private practice for 2 years, and it was a pretty mixed bag there. And one of the reasons that the owner did not take insurance was because of the things I just mentioned. Okay. And you'll find that your pay is going to be slightly higher when you're working at an organization with private pay versus insurance. As far as being on this side of it as a psych NP, would I say that one is better than the other? Not necessarily, because I don't have to manage that. I don't have my own private practice yet. However, there's a lot to weigh out there. Okay. And Miss Real Life, I see that you have a question as well. You're working telepsych. Am I working for a company or private practice? Yeah, so I think I just answered that, but I am working for a company currently. I was working for private practice during COVID, the era with COVID. Prior to that, I was in an office, and then I did transition to telepsych with the owner of that practice, but currently I'm working for a company. Um, and I don't have my own private practice yet either. Okay. So really good question. Hopefully I answered that for you guys. and this will be recorded. So if you guys have any other questions after watching this video or anything that you want me to expound upon based on the questions that were asked today, I'm glad I did this today actually because it did catch quite a few more people. But I'm always open to questions. Anything you guys want to ask me, feel free to do so. Um, by the means on my channel, the About section, there's quite a few ways that you can contact me. I have someone asking me, when do I plan on opening my private practice? More to come on that. I'm just trying to figure out some things as to what it looks like here in my state. Um, there are some ramifications with kind of how that process looks in different states because this is not an independent state, meaning that I do have to have the supervision as well as some oversight for my practice in North Carolina. So I'm just learning the ropes on that. I'm not going to say I'm in a rush to do so, but that is in a part of my future plan. Yeah. So thanks for the question. But as I said, you guys feel free. Hopefully, this was helpful. I will be doing another one of these in another month. So just stay tuned for that. I'll usually post the date on my channel, and it's usually dated and timed. And so you'll know the next time that I'm going to go live. But I'll definitely try to stick with this once a month, and we'll go from there. Okay. Well, you guys have a great rest of your Labor Day. And I look forward to connecting with you guys, whether it's on the channel or offline. Um, and feel free to ask me any questions as they come up. Okay. All right. You guys take care. Bye bye.